I have seen many, many, many patients lighten back up after surgery. Not acceptable, will not be tolerated. If you come into the hospital with a perforated bowel, I'm going to say you knew what you had, you knew what you were facing, you knew what the potential complications were. I'm going to tell you guys, the bottom line, this pinch between your cheek and gums can cause a perforated ulcer. That perforated ulcer, guess what? It can cause peritonitis. Peritonitis can cause death. Peritonitis can cause you to be in the hospital for a week, 2 weeks, with IV antibiotics, return to surgery, and it doesn't take long. And what we're seeing is people who are 2, 3 years out that are starting these practices. You know, it may be for stress or whatever. I need you guys to find something else to deal with your stress. So, kind of with that being said, the other thing, I had posted on Facebook, you know, I've seen a lot of people who have had their bariatric surgery and they've started smoking again, or never smoked and started. One person posted on my Facebook, she said, yeah, I tried a cigar with my girlfriends and my stomach hurt afterwards. Okay? It doesn't take long, it doesn't take much, guys. So then came people that I've known that are 10, 11 years out from surgery. They said, my doctor prescribed me meloxicam. Meloxicam is a medication that people take that's an anti-inflammatory. She ended up in the hospital. Her primary care doctor. Her doctor said it was, her primary care doctor said it was okay. She didn't check with her bariatric surgeon. Guess what? She went to the emergency room because she wasn't feeling well. How she wasn't feeling well? She was dizzy. She felt weak. She passed some blood through her rectum. She had a perforated ulcer. She had a GI bleed. Same with the people that smoke. Okay? It's got to stop, guys. If you're doing it, you need to stop. Nicotine patch doesn't count. You can't do a nicotine patch. You're getting the same effect. It's systemically in your system. Okay? Can't do the patch. You're going to have to cut it cold turkey. No gum, no patch, nothing. If you've got these arthritic issues and your primary care doctor's ordering stuff that you don't think you should be taking, you have to call Dr. Yadegar's office. Talk to one of the girls in the office. Can I take this? What should I take? You need to educate yourselves. I have a list of all these different medications that patients who have bariatric surgery shouldn't take. You know, things like meloxicam, things like disalcid. A lot of different medications that your primary care doctor may tell you, well, you're a couple years out from surgery, it's okay. It's not okay. You still have the same issues. You still have the potential to get these ulcers. I know I'm sounding really mean and nasty, but I'm only being mean and nasty because of the fact I do not want to see one of you guys that I've developed good relationships with show up with an ulcer. They're ugly, guys. I have pictures. Once I have patient names off of these pictures, I will be sharing them with you. When you see ulcers that are the size of a silver dollar that perforated through someone's bowel at the hands of either smoking or taking a non-steroidal, drinking too much coffee, drinking too much alcohol. There's big 4 things, you know? I mean, I know I sound just but it's just because we care about you guys. You guys are sick when you come in with this stuff, okay? Please, please, please heed my warning, okay? Well, depending on how much it feels like it's burning your stomach. Remember, we tell you 1 8-ounce cup a day. That's what our recommendation is 1 8-ounce cup a day after a month. Decaf also has a lot of acid in it. You know, I think caffeinated has more, but decaf still has it. Okay? I mean, I really hate to sound like Debbie Downer to you guys, but this it's the real deal, guys. Adrian's has seen it. I've seen it. You know, I've seen it with patients who've come from that are other practices patients that they're struggling. Okay? You do the surgery to feel good, right? To improve your health. And then what happens is, and we've talked about this before, sometimes we become lax after surgery, right? I mean, I've been lax before. Anybody else? Yeah, you know? So really the bottom line is that we have to look. We have to look at what we're doing. We have to be aware all the time. If you go to the pharmacy and you pick up some medication over the counter, but you're not real sure if it's something you can take that bottle, march your little 2 feet up to the pharmacist and ask. I'm not supposed to have non-steroidals. I'm not supposed to have aspirin-based products. Can I have this? You know, and with your primary care doctors, because the one friend of mine said my primary care doctor said I can take the meloxicam. My primary care doctor said I could take the Celebrex. You know, and their doctors are prescribing this for them, guys. They're primary care doctors because they're far out, so it shouldn't matter. I mean, I know I'm really sounding like a nag. I really am, but you guys have to take care of yourselves. And you know what? You have to be your own advocate. If your primary care doctor, it's okay, you're 2 or 3 years out, it's okay that you can do it. It's not okay. If we tell you it's not okay, it's not okay. Yes? Coffee's not good. You know what? 1 cup a day is okay. 1 cup a day is okay. You know what? It cures what some of the people have issues with their bowels too. You know, coffee can have a laxative effect for you. We are having an event, and it's going to be fun. It's going to be more like a tasting party. It is for patients who have had surgery with Dr. Yadegar, that we're having an event here on November 20th. And it's a fancy, you get to put your fancy duds on, okay? It's for patients only. We can't have the family because we're already pretty crowded. And that's why we're limiting it to patients who Dr. Yadegar has done the surgery on, because we have so many people. So I want you to, if you're interested, November 20th, it's going to be on this floor, cafeteria. I just talked to them today. They're working on trying to make it really nice. We're going to not really do full meals, but we're going to do tastings, and we're going to have it in phase 1, which is the first 2 weeks, phase 2, which is the 3rd and 4th week, and phase 3, which is 5 and 6 weeks and beyond. We've got some kind of really decent kind of tasting food that they're putting together. We kind of got a real varied menu, and the purpose of that is for you guys to see that there's a lot of stuff out there that you can have that you didn't think that you could have. I mean, one of the things I'm really excited about is they're making a butternut squash soup, and I really want to try it just because it sounds so good. So, but I look forward to seeing you guys there in your pretties. And what we're going to do is we're going to have some of the nurses from the floor come. We're inviting the dietitians to come. Dr. Yadegar is talking about having the OR staff come. You know, some people that you probably have never seen. And the thing is, patients ask about you guys all the time. How is that man? How is that lady? You know, I remember their family here. They remember you, but they don't remember you from what you look like now. So with that being said, we're also going to need pictures, okay? Before pictures and an after picture, okay? And did you want them emailed to you?
To Mary.
To Mary. They'll be emailed to Mary. So the other thing is that, it's Halloween is next week, guys. Strategies for dealing with Halloween, holidays. Questions. Some people have kids at home and they want all that nasty old candy at home. I heard you give the first person who gets it all. For me, any kind of candy is enticing for me. Seriously, any kind of candy is very enticing for me. Anybody have any plans on how they're dealing with it? If you guys think about it, we are now in a week from Halloween. All that food, all that stuff now is ramped up until January 2nd probably. I mean, so for those who are a little bit further out that now can eat a little bit more, those who are just in the beginning, these are times that you have to start, evaluating How are you going to deal with it? Last year, Mary said, I'm going to try a little bit of everything. And she did. And she stayed in control. You know, I mean, do you look at eliminating certain things, or are you going to try everything? Those are things, you know, strategies you have to look at. What is it that you think during the holidays that could really get you out of control? What do you think? For me, my brother-in-law, they used to do this big giant prime rib every year, and I'd be like, you know, oh my God, I get to have prime rib. I mean, I would even go as far as call my sister-in-law, Betty, what are we having for Christmas, or what are we having for Thanksgiving? Oh, we're gonna do some lobster, and we're gonna do some shrimp, and we're gonna have cheese, and we're gonna have prime rib. I'm like, oh, you know, and they'd get these like 3 big giant prime ribs, because there was a lot of us. 3 big giant prime ribs, and I'm like, when it was time to eat, Dennis, I'll help you carve that. You know? And so as we're carving it, I'm nibbling on it, you know. And when it came time to eat, this was pre-surgery, by the way, and I'm like, oh my gosh, I said, I claim all the ribs, you know, because they got the prime rib with all the ribs, and I said no, and I wouldn't let anybody have any of the ribs. I would bring them home, because I mean, that's how I was wrapped in food, you know. So what are things that might be a trigger is what I'm looking for you guys. I love candy. I haven't met any kind of food that I really don't like. You know, that could be why I weigh 330 pounds. So, I mean, I have to really check myself at the door. I really, really do. I have to really, really plan. Because if I don't plan, I get in trouble, you know.
You won't touch sugar.
And I'm not willing to get in trouble. If you think about it, you could have one here, one there. Oh, I'll have another one, you know, till you push the edge, you know, and so you could do that, and that's called grazing, you know, and that's one of the things I think a lot of people during the holidays might get in trouble with, is that they graze throughout the day. Because, you know, you go to some functions and, you know, some people have cheese and maybe they have nuts, and, you know, at my house as a kid growing up, my parents always had a big basket of mixed nuts. You know, we'd have to crack them, and, you know, that was a big thing. We'd sit and, you know, eat mixed nuts. At my husband's family's house, they put out cheese and they put out vegetables, which was good, but I didn't eat that. They put out, guess what they put out? Everyone knows what I love. Chips. Chips. They always had chips. So there was chips, there was cheese, there was crackers, there was, you name it, it was there. Yeah, that was there too. There was all kinds of stuff. And I would help myself to all of it. Guess what? It hasn't changed. It's still there. Yeah. And now I have to just be real diligent in my discipline, in definitely disciplining myself to stay away from that stuff. And I think at this time of year, you know, there's this function to go to, that function to go to, and you really have to work on your discipline, you know. And sometimes discipline, when those things that you've liked for so long are staring you in the face, sometimes the discipline can get a little weak. Cross addiction is, so, you know what, most of us have had an addiction with food, right? You're replacing it with something else. Now we can't soothe our feelings, soothe our emotions. We're happy, we're sad, we're bored, we're whatever. So what do? People will shop, people will drink, people will turn to sex, people will gamble. These are real problems, and they're out there. I don't know if you guys remember when, it was a couple years ago, a few years ago, there was someone who came and talked at support group about how after her bariatric surgery she had gone into some real significant problems with alcohol. And she stood right up in front of the room and said, I am so-and-so and I'm an alcoholic. And then she proceeded to tell her tale of how things had transpired. And I was shocked. I was absolutely shocked. I've known her now for 10 years. I didn't know she had gone that far off the edge. and she pretty much held it together. But she had a friend that she hung out with, and I mean, it got real dark and ugly from everything that she talked about. We didn't videotape her because she, you know, she does work and she does sales and that kind of stuff, so we didn't want to put her out there publicly, because if she were to ever go from one job to another, you know, in this day and age of social media, you know, I don't care even if you block your social media, if someone wants to find you bad enough, they're going to find you, and they're going to find what you're doing. So out of her respect, that was a support group that we never videotaped.
There were a lot of people there that night.
There were.
It was powerful, and there were a lot of people. I blogged about this before, because I've worked in this field for, I don't know, since 2001. And I worked with a lovely woman who had gastric bypass in 2004. Gorgeous, gorgeous woman, beautiful inside and out. And she's gone now. And it probably took her, she ended up leaving her position. She worked for me, for this surgeon. And it was sort of strange the way she left. And come to find out, she reached out, she had her surgery. When I saw her, she was probably like a size, I guess she was just at a 40 BMI. And when I saw her, she had gotten down to probably a size 4. She was like 5'9". So she was, talk about thigh gap, she was like skeletal. She started drugs and alcohol. She left her husband. She left her 3 children. Got arrested multiple times. And I was working in the office. And I'm gonna cry. I remember Dr. Yadegar was there. We were seeing patients, and I got the call that I knew was coming someday, that she was dead. They found her. She died, and she had not done anything. It wasn't a suicide. It wasn't an overdose at the time. Her body completely shut down, because obviously she wasn't taking care of herself anymore. She wasn't eating right, taking vitamins, doing anything. And we're taught, this was probably like maybe 5 years after surgery. The drugs, alcohol, and that lifestyle killed her.
It catches up with
and
you.
she was and when she died, she wasn't even 40. Maybe she was like 37, 38.
And if you or anybody else is struggling with that, you need to reach out. We're never going to be here to be punitive. Even though I was like about that smoking, we're never going to be here to be punitive. We want to reach out to help you guys. You know what? And we all struggle. We struggle with our food. We struggle with our staying on track. But there, like Mary said, it's the big elephant in the corner no one really wants to talk about, because it's there. It is there. You know, it may not be any single one of you in this room, but I guarantee you guys, it's there. It really is there. And you need to, if you know it, you need to address it to the person, you know, because it's true, guys. It really exists. I've seen it exist with a lot of people. I've been at this now, living this lifestyle for almost 10 years, and it exists. I've seen it. I've seen the behaviors. I've seen the reckless behaviors. It's like, oh, wow, that's, you know, not just the drinking, but you don't even want to know the things I've heard. But it's like, wow, that would make a sailor blush, the things I've heard. And these are people who've had bariatric surgery, and I think some of the things is that, you know, I mean, how many of you have been heavy your entire life until you had bariatric surgery? So really the bottom line is that, you know, you have surgery, you lose weight, you're starting to feel good about yourself, you're kind of getting out there and being recognized by people. Well, you know what, that feeds your ego. And I saw it with people. One thing leads to another, and you're in some situations that aren't quite so good. I've seen marriages completely crumble. I've seen them come back together. I've seen other relationships completely crumble. But really the bottom line is that, you know, there's all this other stuff that's pushing it. You know, it's the attention that you maybe were never used to having. And I'll be honest, I've seen it more with women than with men. I have seen some of the behaviors with men, but usually it's women that have had very poor self-esteem their entire lives, you know. And it's sad to see, but I've seen it, and like I said, I've seen women who just after they've, you know, started leading this crazy wild life, all of a sudden you don't see them anymore because they're ashamed of their behaviors and stuff that, you know, that they have had. So. A color run, it's 3.1 miles, and you don't have to run. Dr. Yadegar did it. It's 3.1 miles, and you go through these things, and they throw this color at you. I came out I was finding stuff coming out underneath me and in my hair and my ears. All that you could see was I had white teeth, but I was yellow, I was green, I was purple. Mary's daughter did it, and it was hysterical. I got a picture of Mary's daughter and another one of our patients posing at signs, and I don't run very fast, so I kind of lost everybody else. And Dr. Yadegar, he just took off like he was.
Two on the list after Back on Track was stress and emotional eating, which is, I think, what leads to the cross addiction. Mm-hmm. What are you guys doing for, you want to eat, you're stressed or you're bored? I mean, in our private Facebook group, a lot of people talk about being bored.
We have someone really struggling.
So what do you guys, if you're doing well with it and you think and you're not grazing or doing something to numb with food, what are you doing? So does everybody know what color their pee is? If you're in the private Facebook group, you'll understand this.
Yeah.
The colors of your, what color is your pee?
Looks like water, you're overhydrated. Seriously.
Is that a bad thing?
Yeah, you're overhydrated. You want it just to be like a pale yellow. Because what happens is that you need your gastric juices to help you absorb it. You can't absorb it. Even with decreased gastric juices with a sleeve, you still need, the other thing, it can make you prone to kidney stones.